Hello everyone, my name is Shazia Binti Batakar. I'm a Bachelor of Health Science Management student at MSc Shah Alam. I recently interviewed my friend Ula, who is an international student from Saudi Arabia. Today, I will compare Malaysia and Saudi Arabia specifically on how both countries handle the vaccination practices. In this video, I will cover 4 main areas: the vaccination system and cost, preventive health and promotion strategy, public response and cultural challenges, technology and innovation. And then, I will share my personal reflection on what Malaysia can learn from Saudi Arabia. First, let's talk about the vaccination system in both countries. In Malaysia, we have the National Immunization Program, or NIP. Under this program, every baby in Malaysia receives free vaccination shots from birth until 18 months of age. Currently, there are 10 types of free vaccination that protects against 13 vaccine-preventable diseases, including tuberculosis, hepatitis B, polio, and measles. In Saudi Arabia, I asked Ula if they have a similar program. Let me play a short clip of her answer.
Not similar program, but we have this kind of programs. Even for example, some newborn child they born, it's necessary to take some kind of vaccination, and some vaccination is must for the adults.
So, Saudi Arabia also has mandatory vaccines, especially for newborns and adults. Research shows that Saudi Arabia follows the vaccination recommendation from the Saudi Thoracic Society, which advises that all individuals over 6 months should receive annual vaccinations where applicable. When I asked if vaccines are free, Ola told me,
But for the vaccination, for example, it's a viral, just like we all know the COVID recently. What about this? This kind of is some pandemic and anything. Then there's the vaccine is free, totally free. Government will pay for everyone. You don't need to pay a single charge.
For school entry, Ola said children need a health certificate. Same in Malaysia. Both require proof of vaccination for school. The key difference here, Malaysia focuses on childhood vaccination. Saudi also enforces adult vaccination, especially during outbreaks. Next, how do they promote vaccines? In Malaysia, we use community-based methods. Health officer visits schools, mothers get a buku pink to track vaccines. In Saudi Arabia, Ola explains their technology-driven approach.
So we have apps like Tawakkalna, Upshur, we have apps. So we need to show our health certificate in the app. For example, when the pandemic, I remember we cannot go to the mall without our certificate. So just like this, if there is a overall viral in country, in city, so it must be like you have to show your certificate to enter anywhere. It's mandatory.
I also asked about COVID-19 outreach. Could people in faraway areas get vaccinated?
Yes, it's because of the people convinced they make centers near to every district. Like for if you live someplace, so they make health care centers. So it's SMS will come on your phone, so you can go to nearest area of your home and you can do your vaccination. I think 80 to 90% people are vaccinated there.
So the key difference here, Malaysia relies on education and voluntary compliance. Saudi uses mandatory app-based verification, which is you cannot enter a mall without showing your vaccine status. Now, how do people respond to vaccines? In Malaysia, childhood vaccination rates exceed 95%, but some concerns exist. For example, they're concerned about halal certification and social media myth. In Saudi Arabia, I asked Ula about public attitudes.
Everywhere you find some kind of weird people who don't believe this kind of thing. They think it's not effective. It's side effect.
I ask how the government handles those who refuse.
They give them penalties, fines. Or if I am vaccinated and I get someone affected from by me, so it will be charged on me.
So the key difference here, Saudi uses fines and penalties. Malaysia uses education and awareness. I also ask if vaccination is a normal topic in her family.
No, it's very very normal. It's very common. Like we ask each other, did you vaccinate?
In Saudi, discussing vaccines is very normal. In Malaysia, it's also common, but some people are still hesitant to talk about it. Finally, technology. This is where the biggest difference lies. In Malaysia, we use MySejahtera for COVID-19 records, but for childhood vaccines, we still use the paper-based Buku Pink. In Saudi Arabia, Ola explained their systems.
In apps, your ID card, everything will be it's registered. It's because the app is controlled by government. So you need to put your national ID and everything. So the government have record, are you vaccinated or not?
I asked if they use paper cards or digital records, and she said,
it's all digital system. There is no paper based. No, all digital system.
Wow.
We have virtual cards.
Saudi Arabia is fully digital. Vaccine records link to national ID. Malaysia still use hybrid systems. And finally, I asked Ola what technology she wishes Saudi would adopt.
I think to make it more common by telling people like do vaccination. It's already common, but there are still some kind of people who don't believe this.
Interestingly, Ola said education, not more technology, this is what she thinks the biggest need. Now, my personal reflections. First, acceptance. Both countries have high vaccination rates. Malaysia relies on trust and education. Saudi combines education with enforcement and digital tracking. Secondly, which one do I prefer? So, personally, I prefer Malaysia's approach for routine vaccines because it builds awareness without fear. But I admire Saudi digital system for emergencies, which is, for example, during a pandemic, knowing instantly who is vaccinated save lives. What can Malaysia learn? Malaysia should create a single digital health ID linked to our national IC. Currently, our records are scattered. MySejahtera for COVID, Buku Pink for children, and also separate system for adults. A unified digital ID would make tracking much easier. Also, brief multimedia education. like short videos and infographic, can boost vaccine acceptance. One study found it increased acceptance from 30% to 58%. To conclude, both Malaysia and Saudi Arabia have strong systems. Malaysia excels in community-based education. Saudi excels in digital integration and enforcement. I would like to say thank you to my friend Ula for her time, and thank you for watching.